Just to orient everybody, this is a special joint session of the Commission on Environmental Justice and Sustainable Communities, the Lead Poisoning Prevention Commission, and the Children's Environmental Health and Protection Advisory Council. And I'm pleased to say that I spelled those all correctly, which is no mean feat. Just as a way of orienting, we're going to do introductions. In fact, let me just go to the agenda first. This is a special joint session that the chairs agreed to, and the commissions jointly agreed to. And the order of business for the day is to spend some minutes introducing ourselves, then to have a problem statement with opportunities, which I'll present, and then a facilitated brainstorming on potential opportunities and considerations related to housing, health, and health equity priorities for the state. And then at the end of that, to look at whether or not we can set some priorities, either jointly or independently, based on the input from the council members, commission members. And then there will be, as always, an opportunity for public comment, and members of the public will be able to offer statements of up to 3 minutes. This is the agenda that's jointly been agreed to by the three chairs, Camille Burke for the Commission on Environmental Justice and Sustainable Communities, Ruth Ann Norton for the Lead Poisoning Prevention Commission, and myself as chair of the Children's Environmental Health and Protection Advisory Council. So with that, I will stop sharing, and so that we can then go back and see everybody, and ask Ruth Ann Norton if she would like to introduce the Lead Poisoning Prevention Commission members.
Well, good morning, and I'm so glad to be with the other commissions, and I would see a number of good friends, and we welcome you together with the commission. Our commission set out in House Bill, I can't even remember what it was, back in 1994, but reestablished the Lead Prevention Task Force that had existed prior. And we have been in full existence since 1996. And I hate to say I've been around for every single one of those commission meetings over the years. I took the chair this year at the request of Governor Hogan and Secretary Grumbles. We are endeavoring to close the gap between our 99% reduction in childhood lead poisoning related to the kids that we do test and the realities of those that we miss. We are obviously looking to incorporate what is happening on lead in water and expanding our reach on other sources of lead. But I'm so glad that we are intersecting here across these commissions, because we also have to look at health equity and how we effectively have lead in all policies, ranging from climate interventions to other environmental health interventions. And I would like to ask the members of the commission to introduce themselves as following here, but I serve as the president and CEO of the Green and Healthy Homes Initiative, a national nonprofit that is headquartered in Baltimore and was founded in 1986 as Parents Against Lead. So if I don't know how we want to do the order of this, Cliff, so I'll just ask commission members to quickly introduce themselves and who they represent.
Hi, I'm Barbara Moore. I'm the director of the lead poisoning program at Mount Washington Pediatric Hospital. I've been a commission member since 2000, I think, somewhere around there. Have been actively involved in lead programs since about 1998, somewhere around there, and have been a commission member. And thank you. Okay.
Ruth Ann, I'm happy to go next.
Great.
I'm Mary Beth Haller. I'm Deputy Commissioner for Youth Wellness and Community Health at Baltimore City Health Department. And on the board, I serve as the representative from local government. And I'll turn it over to Adam.
Adam, you're muted.
Sorry about that. Adam Skolnick. I'm the Executive Director of the Maryland Multi-Housing Association. We represent the owners of apartment communities throughout the state of Maryland.
Paul?
Hi, Paul Rogers, neurodevelopmental pediatrician involved in managing kids with lead poisoning since early 90s. Just want to mention we were successful in getting our ECHO grant from National AAP, and we're going to be looking at developing best practices for testing and follow-up of lead poisoning children in private practices across the state.
Congratulations. And Paul, you put a tie on for this meeting, so we have to.
This is a big one, yes.
Jack Daniels, maybe?
Sorry, I apologize. Can you hear me?
Yep.
My name is Jack Daniels. I'm the Director of Special Loans for the Maryland Department of Housing and Community Development. I've been with the state for about 6 years and a commission member last year.
Haley or Paula, I'm not sure which is the commission member.
That would be me. Hello, everybody. Good morning. My name is Paula Montgomery. I represent the Maryland Department of the Environment on the Lead Commission. And I've been a representative on the commission, oh, Lordy, for many years.
Angela?
Good morning. I am Angela Paul. I'm the family nurse practitioner representing Office of Child Care from Maryland State Department of Education. I've been the commission member since 2015 and been in public health for many, many years. I'm glad to be here. Welcome. Thank you.
Susan Kleinhammer?
Good morning. Thanks, Ruth Ann. My name is Susan Kleinhammer. I am the owner of Lead Tech Services, probably one of the oldest lead training providers in the country. Been involved in lead poisoning prevention since the late 1980s. Worked for the City Health Department in Baltimore, worked for the City Health Housing Department, and now I'm in private business, and I'm a commission member and represent the risk assessor for this committee. Thank you.
She might have as many business cards as Secretary DeBlata. Jacob?
Hi, good morning. Jacob Benzaken here, owner of JVZ Management, property management company, and a pretty recent commissioner. So I am in awe and learning from everyone in this room. So thank you for allowing me to be part of this incredible mission.
Great, thank you. Anna Davis.
Hi, I'm Anna Davis. I am a commission member since I believe 2016. I'm a faculty associate with the Bloomberg School of Public Health in the Department of Health Policy and Management, and I'm also of counsel with Gordon Wolf and Carney in Towson, Maryland.
And you just welcomed Maya Cummings, I think, to the health management there. If we have missed any commission members, could you identify yourself?
Yep, thanks. I'm Christina Push, Executive Director of the Maryland State Child Care Association, representing over 5,000 child care professionals, and a commissioner for about almost 7 years now. As a nonprofit, we are representing the child care community.
Wonderful. And Christina, sorry for missing you there. Anyone else?
Yes, and good morning. This is Benita Cooper representing the Maryland Insurance Administration. I've been a commissioner for several years now, and I've learned a lot and looking forward to learning a lot more. So thank you.
And Benita, thank you for your feedback on the New York Times article we'll share with the commission.
You're welcome. Thank you.
Cliff, I think that does it for us, I believe.
Yeah, this is Clifford Mitchell. I'm the secretary's designee on the Maryland Lead Commission.
There you go. So we'll move to the next commission, I think.
Right. So why don't we move to the Commission on Environmental Justice and Sustainable Communities? Camille? You're muted, Camille.
Can't figure out how to unmute.
All right. Lisa, do you want to do the honors? Oh, there's Devin.
Good morning, everyone. I will do the honors, I suppose. We're going to keep going. As you saw, the chair, Camille Berg, is with us. And she serves on both commissions. Actually, all three commissions she serves on. She's on the lead commission. She is the chair of the Commission on Environmental Justice and Sustainable Communities, and she's also in that role, it makes her a member of CPAC as well. I see Crystal. Are you on?
I am. Can you hear me?
Yep, sure can. Go ahead.
Okay, hold on. Good morning, everyone. My name is Crystal Faison. I am owner of Shepherd Design and Construction, where we provide construction and energy efficiency services throughout the state of Maryland. I represent Prince George's County. Thank you.
Paulette?
Yeah, I'm Paulette Hammond. I'm the president of the Maryland Conservation Council. I've been a commissioner for about 3 years, 3 years, and I represent the community.
Paula?
Hi, I'm Paula Dannenfeld. Been on the commission, I think, little over 3 years. I have a long history in the water sector, representing public utilities through trade association. I'm now retired, and I serve on the commission in a public / general capacity.
Let's see, Vancia?
Good morning, everyone. My name is Vancia Moloch. I've been on the commission for about a year. I live on the Eastern Shore. I'm the IT support director at Purdue Farms, representing the business. Glad to be here. Thanks.
John?
Sure. John Topani. I'm in the division, I'm a program officer in the Division of Neighborhood Revitalization at the Maryland Department of Housing and Community Development.
John, it's been a long time.
Suba?
Hi, good morning, everybody. My name is Shuba Chandler. I am the Deputy Director at the Environmental Health Bureau at the Maryland Department of Health. I've been there about 8 years and work on projects related to health equity and housing, intersection of housing, planning, and injury and violence. So I'm very happy to be here on the commission for probably 6 of those 8 years, and probably the one commission that Cliff is not on. So very happy to be here.
And I serve as the staff for the commission, but I am also the designee of when the secretary can't be here. But the secretary is here. HT, did you want to say anything? I missed if you already said something.
No, just welcoming everyone to the commissions, and I'm glad to be serving in this capacity. And I think I'm among friends. I've worked directly and indirectly with many of these commissions, so just look forward to continue working with you guys. I'm not new to MDE. I've been with MDE 37 years. That's 37 in December. So in all kind of roles, and but I've always been passionate about protection of children, advancing health protection in the state with issues of equity and justice to have good housing for the people that live in all areas, and so that's been, and this bringing the 3 commissions together creates like a synergism of all that we are about. There's a little bit of in each one, and I don't want to create a super commission because we have, I don't want to dilute the facts, but I think each one does great work, and coming together at least once or twice a year, it helps a lot. So that it was cross-pollinate. a little bit. So, and I'm glad that, Ben Grumble was a great mentor, and he's departed Tuesday to what I call green and different pastures. I mean, he's going to take a lot of national policies across the country, and it's great. And so I have a great staff, and I look forward working with many of you. And I'm easily reachable. So,
Are there any other EJ Commission members that did not introduce themselves?
Hi, I'm Phil Wilson from the Maryland Department of Transportation. I'm the newly minted Environmental Justice and Community Outreach Manager. I'm also the Secretary's designee on Project Green Classroom, so I'm very excited to be a part of the discussion today.
Good morning, everyone. This is Leslie Ann Titos, and I'm a faculty at Johns Hopkins Bloomberg School of Public Health, and I've been in the commission for a few years. I started back when I was at the University of Maryland prior to my job at Hopkins.
Madam Chair, I think you have all your commission members introduced.
Thank you. CPAC Vice Chair Dodson. And so we'll introduce the members of the Children's Environmental Health and Protection Advisory Council, which was started back in the early 2000s by the legislature and created to address specifically issues of children's environmental health. I'm going to go in some kind of order based on reverse alphabetical order, I think, maybe. So Dr. Sharma, Dr. Shweta Sharma.
Hi. Hi, can you hear me?
Yes.
Dr. Sharma, if you may have to unmute.
No,
We can hear you, but barely.
Okay. Yes, can you hear me now?
Yeah.
A little better. Yep.
Hi. My name is Shweta Sharma, and I'm the Certification and Training Coordinator for Maryland Department of Agriculture. And I believe Kelly is here as well.
Right. Kelly Love is also here from the Department of Agriculture and has served as a council member up until this year, I believe. Thanks, Dr. Sharma. So for those of you who may not have heard, that's Dr. Shweta Sharma from the Maryland Department of Agriculture. Next, I think, going down is Paul Ferraro. Dr. Ferraro.
Paul Ferraro, professor at Johns Hopkins University in the Department of Environmental Health and Engineering and the Carey Business School. I'm the economist on the council, and I've been on the council only since last November. Nice to meet everybody.
Excellent. Nsay Witherspoon, known to many of us. Nsay, you may be on mute.
Okay, maybe my earbud didn't work. Is that better?
Yeah,
Okay.
there you are.
Hi, Nsay Witherspoon, Executive Director of the Children's Environmental Health Network, a national nonprofit focused on protecting all children from environmental hazards, and we're based in Washington, D.C. I've been on many years now, losing count. Pleasure to be with everyone.
Excellent. Dr. Megan Latshaw.
Hi, I am a faculty member at Johns Hopkins in the Department of Environmental Health and Engineering. Been appointed maybe 3 or 4 times now, so maybe 12 years. And I represent toxicologist on the Children's Environmental Protection Advisory Council.
And I had a small disclaimer. Megan and I have known each other a very long time since we worked at Hopkins together. And so it's a real pleasure to work with her on the council. It is, as with many of you, it's great to see old friends here as well. Laura Allen.
Hi, my name is Laura Allen. I am clinical faculty
at University of Maryland School of Nursing. I'm also Senior Program Manager for the Community and Public Health Environmental Initiative. We provide nursing services and environmental health oversight through the Eco Healthy Childcare Program to early Head Start and some Head Start centers in Baltimore City, and now family support centers. So we're branching out across the state.
Thank you, Dr. Allen. Next, I think, Kristen, where are you?
I'm here in virtual land. Good morning. My name is Kristen Rowlett. I am also faculty at the University of Maryland School of Nursing and a family nurse practitioner, and I represent higher education and perform duties as assigned. Nice to meet you all.
We have a
Thank
few.
you. Thank you, Dr. Rowlett. Dr. Gitterman.
Hi, Ben Gitterman. I represent clinical medicine. I am actually a practicing pediatrician. I'm at Children's and in a private practice. I'm on the faculty of GW School of Medicine, School of Public Health. I have been on this council for a very, 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 very long time. We'll leave it at that.
Since before it was a council, actually. Eamon Flynn.
Hi, everyone. My name is Eamon Flynn. I'm Senior Health Policy Analyst in the Environmental Health Bureau at MGH, and I am staff for CPAC.
Did I miss any CPAC members? Oh, there you are. Sorry, Christina, I didn't see you. My apologies.
No problem. Thank you, Cliff. Good morning, everyone. My name is Christina Drusha Williams. I am the Chief of Community Initiatives at the Children and Youth Division of the Governor's Office of Crime Prevention, Youth and Victim Services, and I'm representing the office and our Executive Director.
Thank you so much. Anybody else? Okay. Well, I think that was very helpful. So we have everybody.
Cliff.
Go ahead, Devin.
Cliff. First of all, I serve as the vice chair of the commission because of my role as the representative for Maryland Department of the Environment. And Chairman Burke has her microphone fixed and has raised her hand.
Oh.
Thank you so much. I apologize for all of the technical difficulties. I'm actually in the office and didn't want to have any technical difficulties, and this is where I had the technical difficulties. Just wanted to say thank you and how heartening it is every time I look at the number. There are 59 people on this call. That's absolutely one of the most amazing things for those of us that sit on these commissions. But wanted to welcome you on behalf of CJAC. Devin is absolutely right. I think Cliff and I have the joy of sitting on all three commissions. Unlike everyone else. I'm excited also about my friends from MDOT being here. They were so amazing this past year, and Dorothy's here as well, wanting to actually do a specific EJ policy and have that conversation. And that's huge. And I'm sure you all have heard a lot about us this past year. Every year when session goes by, we get quite a few statutory duties added, and we had quite a few added this year. We seem to be the hot commission, and I'm hoping some of that rubs off on y'all's commission, so we can add some more to what you all do, unlike what we do. So I'm looking forward to the work that we're going to do, not only here, but in the future as well. I actually represent Baltimore City outside of my other life, my work life as well. So that's how I sit here. So I'm curious to see what we do and looking forward to taking some of these suggestions back as well and how it will figure into the work that we do. Thank you.
Thank you so much, Vice Chair Dodson, and thank you so much, Chair Burke.
Cliff, if I may, one thing, Camille, you did get a partner in crime because the White House did open the Office of Environmental Justice at HHS, who I know, and in addition to the EPA, CHPAC, I hope will be partners for the Maryland Commission, and I look forward to helping us facilitate that.
Okay, so what I'm going to do with everybody's permission is just return to the slides and go through until we get to the point where we're all going to sort of take turns on this. And I think that just a couple of things about the order of today before we start, just some logistical issues. One is, I think, Wendy, this would be a good time to put the Jamboard link in the chat for members of all three groups. This is a Jamboard. Some of you who are outside of maryland.gov will need to ask permission to have this shared with you. And Wendy will share it with you. I would again remind people who are members of the public that the Jamboard is specifically for the council and commission members. And so people who are not on the committees, not members, won't necessarily, will not be invited to participate in the Jamboard session, but will have an opportunity for public comment at the conclusion of the meeting. Secondly, just on one other logistical issue, because there are a lot of people here, and we'll have the Jamboard going and we'll have slides. If you want to say something, please raise your hand, and then either Wendy or Eamon or Lisa Nisley for the Commission on Environmental Justice and Sustainable Communities, or the chairs will shout out something so that we can recognize people and know and make sure that everybody's voice is heard. They will also be taking notes as well as having the recording of this session, so we'll record what takes place. And please don't be shy about this. This meeting was designed as a participatory meeting where there was not going to be so much talking as having all of you share ideas. So with that, let me just go back to the slides if I can, and I'm sure I can mess this up if I try. Let's try this and this. Are you all seeing the slides?
It's coming up.
All right. So as several people have alluded to, these three groups have different statutory mandates. The Commission on Environmental Justice and Sustainability, the Children's Environmental Health and Protection Advisory Council, and the Lead Poisoning Prevention Commission really have have overlapping but different mandates from the legislature. And when we were discussing how to frame this discussion and this joint meeting, we drew on the example that we have already, where the Children's Environmental Health and Protection Advisory Council and the Commission on Environmental Justice and Sustainable Communities meet, which is we try to agree on a joint agenda so that we could really focus the discussion. The issue that seemed to be a common issue amongst all three was the issue of housing. And so I've prepared some background slides just to sort of think about how to frame this discussion. I, at the outset of this, want to issue a disclaimer, which is that these slides are meant to provoke thoughts. They are not meant to be comprehensive. They are not in any way meant to suggest that these are the only ideas worth considering. The whole idea of this meeting is really to have a one-time meeting to address the intersection between these three groups with respect to housing and housing only, in a way that recognizes that we are at something of an inflection point, or a point of opportunity, perhaps, to address housing issues from the perspective and the vantage point of all three groups, and to think about how there may be common ideas, themes, or proposals that may arise from this discussion. I think each of the chairs who have spent, and staff who have spent a lot of time discussing this, recognize that they may not necessarily overlap. The ideas may be separate. This may not result in a common agenda. It may result in ideas surfacing that one group thinks is very relevant to its mission and another does not. But the idea is for us to think about that together, because it's an incredibly, as you have heard from the introductions, diverse but really, really rich set of people with a very rich set of ideas and perspectives. So we've done the introductions, and so I'm going to take an opportunity just to sort of talk about some of my thoughts related to what the hazards and opportunities might be to help frame some of this discussion. As a physician, and in many discussions with many of you over the years, we've talked a lot about the physical environment, the hazards of housing, and the opportunities to address those hazards from the point of view of children's environmental health. Those include chemical hazards in the housing environment, things like lead, asbestos, pesticides, volatile organic compounds, carbon monoxide, and radon. The physical hazards that exist from falls, electricity, fire, and so forth, biological hazards. These are things that the Children's Environmental Health and Protection Advisory Council have talked about for many, many years and addressed over the years from very, very different perspectives. And the opportunity with respect to lead that this represents is, we'll talk about in just a second. And then I'm sure many of you will have a much richer sense of some of those opportunities than I do. But I think in our discussions, we've also talked about not just housing, but the built environment writ large, from the point of view of community design, from the point of view of things like what are the patterns of historic housing inequity and how have they affected children's health over the years? How are there opportunities now, given some of the things that we'll talk about, for us to address some of those historic health inequities and housing inequities? How can we look for opportunities to promote children's health through increased opportunities for physical activity, green space, health promotion, trees, et cetera, et cetera? What are the potential impacts on violence and injury prevention? When we look at the built environment and think about how it relates to the social environment of children, how does that affect that outcome? The issue of, again, thanks to the Department of Transportation, the issue of transportation access as part of built environment and the availability of transportation and what those all do, not only for children's environmental health, but also for climate change, mitigation and adaptation, and for other parts of the world that are considered and have been considered and are being considered by the Commission on Environmental Justice and Sustainable Communities, as well as the Children's Environmental Health and Protection Advisory Council. I want to mention here some of the opportunities that are unique at this point in time. One is something that some of you may have heard about called the Statewide Integrated Health Improvement Strategy, which I am not going to spend a lot of time talking about, but it is a major commitment on the part of the Secretary of Health, the Governor, and the Health Services Cost Review Commission to demonstrate to the federal government that we are able to both improve health outcomes through our unique health care cost financing system, and also not only improve health outcomes, but also constrain cost growth. And one of those areas for maternal and child health, for total population health, is asthma-related emergency department visits for children ages 2 to 17. There's a major amount of money that's been committed by the Health Services Cost Review Commission on behalf of the hospitals of Maryland and the state to address this issue. And it does demonstrate the importance of housing through our home visiting program, because that's what the state has committed resources to, as well as the hospitals. But there are other opportunities, one of which is the infrastructure bill recently enacted in Congress. And just for the EPA alone, environmental funding includes $15 billion nationally for lead pipe replacement, $5 billion for Superfund and brownfields, and $5 billion for road and highway safety, again, related to transportation access and equity. And there are other opportunities, as well as obviously the changes that are coming in terms of administrations and legislatures and so forth with the new election season. All of those represent, I think, things just to think about as we move forward. So that's just a little bit of an overview and an introduction. Before we get to the brainstorming, let me just ask my fellow chairs.
Cliff, Ruth Ann has her hand raised.
And I was just going there, if they'd like to comment on this as well.
Well, I do think one thing I said earlier when Camille was introducing herself is this interplay now with HHS's Office of Environmental Justice. But as we contemplate the brainstorming session, one thing to think about on the housing front that gives us an opportunity to look at equity, look at health, and look at climate is the fact that the Department of Housing and Community Development stands to either double to close to triple its weatherization assistance dollars through the infrastructure bill, and the opportunity to really align those to these goals. The governor did just veto a bill that was intending to do that, but I do think the commission still ought to take a look at how we align the work that's going to come through the infrastructure bill as opportunities in its execution. And I just wanted to point out that I thought that provided certainly an opportunity in that sense. And the other is how we're all measuring progress in terms of environmental justice, in terms of health equity, and being able to share advancements between the commissions other than just a once, as we come together maybe once a year moving forward. I think sort of reporting out to other commissions opportunities for cross support, this is going to be a great start.
And Chair Burke, did you want to add anything in terms of an overview?
Just a couple things. I am lucky enough to have very robust participation from other parts of the state, thanks to Vancia and Crystal, who's in Prince George's County, and Vancia, who's on their Eastern Shore as well. So I always want us to keep that statewide perspective in mind. And also at some point, and Devin, you can chime in as well, with MDE moving towards their EJ screen being released, and also with the environmental public health tracking system at MDH as well. I want to also make sure that we're using the tools that are provided by the agencies to kind of help the public and also help us in some of the work that we do.
Thank you, Camille. And let me just ask, are there any other commission members or counselors who want to add anything from any of the groups before we move into the brainstorming? Any other sort of overview thoughts? Devin?
Thank you, Cliff, and Madam Chair. Yeah, I just wanted to piggyback on what my chair said, that MDE does have a very exciting EJ screening tool, comprehensive, inclusive of data from EPA and University of Maryland's screening tool, but robustly built with MDE specific data. In tune with Senate Bill 528 and House Bill 1200, the two bills that impact the environmental justice that passed in the legislative session. And the great news is the tool will be released for a 30-day beta test for anybody and everybody on Monday. So this Monday we will have our screening tool released and on MDE's website. So I'm very, very excited for that, and it will definitely help facilitate all of these conversations that all three groups are having, because as soon as you will see it and start playing with it, you will be able to discover information about communities that we have not put together before in one place. So very excited about it, if you can't tell. Thank you.
Thank you, Devin. And I will just add, just for an update on environmental public health tracking, that while the Department of Health is recovering from its network incident in December, we are still continuing development on the environmental public health tracking portal, and we'll be releasing that this year once we've actually reactivated our network and moved it over from its development site. It will have a lot of health data, specifically environmental health data, public health data, and it will complement, as Camille said, the data available on the Maryland Department of Environment site by providing specific locational environmental health data, and specifically to complement some of the opportunities afforded by the new environmental tool at the Department of the Environment. So with that, I don't see any other hands, so let me do this. What I'd like to do is take the next 40 or so minutes to do a couple of things. I'm going to stop sharing now. And if you are now all in the Wendy, have you been able to grant access? Are there any of the council members who have not been able to access the Jamboard?
There are currently 15 people in there, and as you were talking, I was still kind of getting requests, and as I'm getting them, I am granting them, and they're coming in. So I'm not sure who still needs it.
Yeah. So can you again put the link into
Yes.
chat?
Yes.
And again, remember that this is specifically for council members and commission members.
Yes. Only. Yep.
So please feel free if you have not. Ben, Dr. Gitterman.
Pardon the ignorance, but some of us might not know what is Jamboard.
Yes. Well, I was in fact getting to that. So what you are going to be joining, if you click on the link in the chat, is you will be joining a common workspace where what we're going to do is allow people to basically respond to the particular questions that are asked and put little sticky notes up on the Jamboard. This is the equivalent of, for those of you who have done any sort of facilitated idea generation, a place where you can post notes on the board. So just as you add, and I see we're now up to, we're now increasing, excellent. This will, when we go through a series of questions, allow you to put notes up, and then staff will take some time to rearrange those notes into themes that we will then be able to go back and look at. So as you are joining, what we are going to do is we're going to have a series of pages. The first page and the first question is specifically going to be related to opportunities.
I don't know. Give me 1 second, Paula. I'm still trying to grant access. Sorry. I wasn't muted. I'm sorry, Paula.
Keep going, Cliff.
Yeah, I'm writing it in the chat as the question.
Okay.
So the first question is, what are the opportunities you see around housing, health, and health equity? So for you, just go ahead and start adding sticky notes around. And for those of you who are not familiar with this, I think, those of us who have done this a while, and I'm not one of those, who are good at teaching, if you have any problems, please feel free to raise your hand and we can do a little demo. But what you'll see is, and Wendy, you can just, because you've got control now, you can either look at this on the screen. It'll be easier for you, however, if you look at it on the tab that is specifically in the screen itself. And what you'll see is each one of you will be identified. You can add a sticky note by clicking over here on sticky notes and then writing a sticky note in whatever color you prefer. You can either add your name or not. You can be completely anonymous if you wish. And you can add a sticky note and see, and somebody is already doing it, and then just stick it any place. And that's a little test note. But just go ahead and add, again, the question is, what opportunities do you see that are specifically related to, and Barbara is asking if there's a way to get into the Jamboard. If you, Barbara, what happens if you click on that link in the chat? You should get a note saying you have to ask permission for share.
And you go out, once you ask permission, go out that link and then come back and you'll be in.
Okay.
Cliff, I'm also sharing my screen with the Jamboard on it, so if people can't get in, they can see it. And if they have comments, they can say those in the meeting, and I'm happy to record those.
Oh, thank you, Eamon. Thank you very much. All right, so as Eamon is presenting.
Quick question, or not a question, but Madam Chair, Chair Burke, you have 2 additional commission members who have joined. You have Delegate Boyce and Commissioner Brooks have joined.
Thank you. Just want to take this brief opportunity to welcome Delegate Boyce, who has been a active member and keeping us busy and on our toes, and certainly been our connection to the legislature. So certainly want to say hey to Regina, and also Commissioner Brooks has joined us as well. We kind of just finished our overview, and we are actually logging on to the Jamboard, which is in the chat, and we'll post it again. We're trying to figure out, or trying to do a brainstorming session on the intersection of health, housing, and all the work that all the 3 commissions do. So I'll have Wendy repost the link again, because you have to ask for permission. And we're just putting sticky notes under the question. Short version.
Well, yeah.
I was going to say, this is Shuba, that I think we're on page 2, not on page 1. There's a couple of stickies on page 1. I don't know if people who put them there, but happy to move them over.
Oh, thank you, Shuba.
Cliff, do you want to restate your question?
Yeah, so again, to restate the question, we're asking, the first question is, what are the opportunities you see around housing, health, and health equity? Again, there are no boundaries on that. There are no bounds on that. It's whatever opportunities you see that you think that we should be aware of, either as individual commissions or councils or collectively.
This is Paul Ferraro. Just 2 questions. Do I have to do something to post it?
Yeah, so on the left-hand side here, there is an icon that says sticky note. You have to do Control-Shift-P. Click the icon, type your note in, click save, and then you'll have a sticky note.
Then I have to click save. Okay.
Yeah.
And will my font looks enormous compared to everybody else's? Will it shrink?
It'll shrink.
It auto sizes based on the size of the sticky note.
Yes. Thank you, Eamon. All right. Barbara, were you able to get in?
Working on it. I'm working on it.
Okay. And again, if you want to say something instead of that, Jacob, again, I apologize. We beta tested this with a number of outside people. People may have firewalls of one kind or another. That does sometimes happen, and I apologize about that. If you want to put your comments in the chat, that's perfectly okay, and we will transcribe them into the Jamboard. That's okay. If you'd prefer to just say them, one of either Eamon or somebody else will transcribe them and put them in.
It just keeps asking for my email and then asks for Google account, which I don't have.
Yeah, so
I'll just type things in or say it.
If you want to put them in the chat, Barbara, we will move them over.
Okay.
Thank you. Thank you for your understanding. We have yet to decide to find the perfect vehicle for this. So we're going to take about 5 minutes more for people to post on this.
So, Cliff, I couldn't get, people are still posting on the first page, so you'll just have to look at both pages.
Okay.
It was a lot of post-it notes for me to copy paste over here. So, I think if you go back and forth on your screen share between the first panel, you'll see all of these post-it notes. And then I think if you go to page 2, you'll see the rest for the question.
So somebody has a page 3 as well. I don't know, maybe they're not under, it shows you at the top of your screen what page you were on, like 1 of 3 or 2 of 3 or 3 of 3. So if everybody wants to stay on page 1, just make sure you're seeing the 1 of 3 at the top there. It should be in the top center of that Jamboard.
No, we're on page 2.
And
so I have the
Eamon
question
has,
at the top.
the question again is that people are responding to, whether it's page 1 or page 2, is this question, the opportunities that you see that are related to health equity and housing. And I just transcribed that over to page 1 so we know which topic we're talking about. And these are great comments that people are putting up. And when people feel as though they're exhausted on this topic and the rate of comments has slowed down, staff should feel free to kick me. Then Eamon will post that. Thank you.
Thank you.
That's great. These are great comments. Is there anybody else who's having trouble at this point or can't post in the chat or otherwise feels as though they've got an idea that they want to just state? Just looking around to see if there are any hands raised. All right, we'll take about 3 more minutes till 10:30 on this question and then move to the next question. And you can always go back. Thank you so much, Jacob, for doing that. Eamon, can you get that? That's great. That's great. All right. All right. It looks like we're slowing down a little bit. But these are fantastic. All right. Any other considerations before we move to the next question? All right. So the next question is going to be in the chat. What specific initiatives would you propose to address housing, health, and health inequity and equity considerations as a policy proposal or an activity? So I don't limit these. Just what initiatives would you propose? And we will get to just, to give you an outline for the other questions, we will get to how do we measure progress and then what do we need to do these things. So we'll get to needs and tools and measurement in a bit, just so I'm foreshadowing, but just so you know that we will get to those questions.
All right, and I am on page 3. So make sure that you're adding your comments to page 3 of the Jamboard and the questions posted at the top.
Thank you. You just read my mind.
Yeah. Thank you so much, Eamon. So you can certainly flip back and forth to some of the opportunities to think about how you might address those as either policies or activities or actions. If you want some thought provoking on those topics. And while we're doing this, if some of the staff want to take a crack at starting to do a little bit of sorting and grouping. On the first question, you should all feel free to do so. And these are great.
So kudos to anybody who's trying to organize, but Cliff, there, you know, at the state-led commission, we did, I think we shared an asset and gap analysis.
Yep.
And one of the things I did put up here is if we come to some common areas, we could run an asset and gap analysis of needs across, you know, on any of the joint issues. Might be, I'm thinking certainly around any joint goals where there is funding involved, to see if there are both geography and demography basis gaps that we need to make sure we're paying attention to here. And I do think the climate dollars allow us a real interest in what is crossover, and looking at also the unintended consequences might be something that these commissions should jointly take up. As you know, good work often has one or two unintended consequences, so that we can get ahead of it as this is coming down. And one I raised here that and I don't know if NSA is still on the line, but you know, there's a growing concern around lead in food, not only water, soil, and paint, but in food sources, and that could be something at least one could cross two of the commissions, maybe not all. But there are opportunities, I think, to have some shared goals here. And the other is on workforce. To meet these goals is a challenge, I know, for lead and for healthy housing, and a lot of the work we're doing on electrification, decarbonization, asthma reduction. And I don't know if any of the commissions have taken up this quandary that we have on workforce.
Oh, Ruth Ann, you know, you're preaching to the choir when you talk about workforce, and while it may not be directly related to the housing part, I totally take your point. I hope you'll leave it as a theme for us in the notes section, because I think it's important.
The first
Megan?
Barbara's over and do that, and then I will do that.
Yeah, Barbara. So sorry, Megan. Megan, did you have a hand raised?
You're muted, Megan.
I did, and I was talking. Okay, so somebody keeps rearranging things, but some of the sticky notes need to stay together because they're like commenting on the others. So if you're moving things, maybe just read them first. I keep like battling to put my sticky note back to the note I was responding to.
We have a very, very efficient staff who have yeah, no, that's great. Thank you, Megan. Point taken.
I suggest that if it's a part one, part two, maybe try to put that on there. Just like a P1.
No, it's not part one or part two. It's responding to somebody else.
Yeah, no, I understand, Megan. Thank you. And we will endeavor to make. And this will not be the be all and end all. So you can rearrange. And if you see Eamon moving something, you can clunk him over the head in Jamboard space and take possession of that if you feel strongly. Paula, did you have a comment? And then I see Camille.
I just, sorry, I can't find my sticky note that I put on here.
It has not gone away. We have not deleted any. So
okay.
Yeah, what I would suggest, Paula, is put it on again.
Okay.
Yeah.
Will do.
Yep. Camille?
Just wanted to say at some point between the three commissions and possibly across the state, we're going to have to come to some kind of definition of health equity. Because that's the thing that gets us in trouble, is that we're talking apples, oranges, and chickens. And I just want to make sure we're all on the same page, not only here, but statewide at some point, because health equity may mean something different to one commission than it does to another. That's all.
Yeah. And Camille, I just want to add, just because the chairs of the councils and staff met in planning this, a couple of notes while you take 2 more minutes to add a couple more sticky notes. The chairs decided that they would not, that we would really try to limit the discussions and the questions, et cetera, to those questions that are specifically related to housing, health, and health equity without trying to necessarily have a common definition of health equity. But I think Camille raises, as always, an important point, which is each of us is viewing that through our own lens. And we're doing that intentionally, but recognizing that that is a really huge issue that is overlying a lot of these considerations. But we did not want to have that specific discussion as part of this. So I just want to acknowledge Camille's point and say there was a conscious decision made in order to sort of get to a thing on housing, not to sort of have that whole discussion, but we all recognize the value and the importance of that discussion. Thank you, Camille. Any other questions? So what we're going to do, I'm going to go ahead.
I was going to say that, Camille, this is Shubo. I think, we have our definition, right, for our commission. And maybe that is something we need to be more, see if this group would agree to that at some future date as our definition, as something they would adopt as well. Or is ours focused mostly on EJ?
Absolutely, sir. But it's a thought, and I'm happy to share.
Yeah. Okay. And there are a couple of other definitions that have come through this last legislative session that I think, if everyone's not aware of them, like around overburden and some of the other terms.
Vulnerable, underserved, I agree.
Underserved, yeah, now that they've been legislatively defined, it would be, I think, important for us to all know what those are and then know that, what our positions are on those definitions and kind of how we would use them or apply them.
Okay, so it's 10:40 or so. Do people feel tapped out, or has the rate slowed of new post-its being posted? So you can always go back, but I'm now going to put on the third question, which is, what are the tools, data, or other needs that people feel are important considerations in addressing housing equity and health equity? So what do we need? And this is not just what does the state need or what does the state need to do, but just globally, what needs to happen for these policies to come into existence or to address the issues of housing equity and health equity? So this is the opportunity to, what's going to get us from here to there? Thank you, Christina, and thank you, Megan. And I want to just say, one of the reasons I love working with these groups is that there's a real spirit of willingness to engage and help one another in all of these groups.
Did I lose you all?
And is there anybody who, I will again ask if there's anybody on the councils or commissions who is having trouble getting in or unable to get their points across. Please put a note in the chat or raise your hand. Camille, did you have a comment?
I just wanted to, on one of the screens, there's a, does the EJ screen question. Can we set that question to the side? Because I think we can answer that. Does the MDE EJ screen? Yeah. Or just highlight it. We'll answer it later because we can probably help with that right now when we get to the comment section. There it is. Yeah.
And I want to just point out my admiration for the people who know how to tilt a card and a note.
Appreciate that. Thank you.
And make little squiggles.
Cliff, Alicia Mizzou has her hand raised.
Oh, Alicia, welcome.
Hi, good morning, welcome. Sorry I was delayed. I just wanted to agree with the comment about health disparities. And I don't know how to write, I don't know how to access my sticky notes. So that's all I wanted to say.
Oh, okay. If Eamon, can you put the Jamboard link in again? Or Wendy, one of the two of you in the chat?
Yeah, I will do that. You should have, Alicia, you should have on the left. Are you in Jamboard or you're not in yet?
I'm looking at the screen. Oh, I see. Is this it? Sticky note?
Yeah, it's on the left side. You should have some tools there.
Okay.
Yeah, but
And if
all right, I'll find it. Thank you.
yeah, you'll need to click on the link itself, which is now in the chat or is about to be in the chat or is going to be in the chat any minute.
Yep.
All right. Thank you.
And if not, you put your comments in, we can copy them over.
Yeah.
Okay, I did do that. Thank you.
All right. Oh, that's great. Thank you, Alicia.
And Christina, thanks for her comment there.
Thank you, Wendy.
Sure.
Is somebody getting Christina's notes over? Or
Yeah, Megan is on the
Yeah.
case.
I've also added a few of them, so we might have some duplicates.
Yeah, which is perfectly okay.
as we suspected, people with no ideas at all.
Exactly. Yeah. Yeah. No, I must say these have exceeded my wildest expectations. These are great.
So if I am trying to roughly group them into a funding, resources, bottom left, data on the right, health equity, bias considerations in the middle, and process on the kind of top left, very roughly.
Yes. Well, as a policy analyst, I would expect no less.
That's as much nuance as you'll get.
But I will say that no, and I appreciate Eamon. Thank you for doing that. Although I'm sure people will have other frameworks for this, and we'll take a crack at some of that. Let's see. Eamon?
Yes.
Can you, well, you're doing something. What I want to do is, let's see. What do I want here? Unless somebody's got stars in here. I'm making dots. I'm testing the limits of my abilities here. Like it appears you, oh, wait a minute. You can't. Maybe there's a way that Shuba or Eamon of doing a mass copy and select. Because I can't figure it out.
Yeah, there's a way to duplicate them. How many?
No, I know
do you
there's a way
wanna
to
make?
duplicate it, but not a whole group of them.
No, not that I'm aware of.
All right. And I want to do this on all right. Okay, so it looks like we've slowed down. So what I would like to do now is I'd like to take a couple of minutes to do some rough polling. And Eamon, you've done some categorizing, but what I'd like to do is do some polling around with sticky dots, basically, of things that people feel are really, really important, not so important, etc. So I'd like to take a couple of minutes for people to take sticky dots and move them to the things that they think are really, really important, not so important, etc. I would ask that each of you do like 5 sticky dots or so. We'll continue to, or you can copy your own. We're not going to monitor your sticky dots. So this is the honor system. But, consider yourselves to have 5 votes and go ahead and move them to the things that you think are important.
Camille has her hand raised, Cliff.
Yes, Camille.
Hey, just quickly, from what I'm seeing from all 3 pages, you may be able to do some larger topics like coordination. I see as 1. Funding is definitely 2.
Yep.
Or vice versa.
I agree. And what Camille, my thought about this is those themes, we can either lump them before we do the polling or after.
Okay.
And it'll show up either way, is my sense.
No problem.
If that's okay.
No, that's perfect.
So feel free to copy dots.
I just had a quick question. Are we only doing it on this one page or all the pages?
No, this is just for this theme, and then we're gonna go to the policies themselves as well.
Okay.
Thanks, Paul. So if we need to make more sticky dots, I didn't count the number of people and multiply, but I think it's what we've got about 34, we've got about 59 people times 5.
So if MDE, EJ Screen, or the Maryland Tracking Network does not have housing data about violations.
So it's Camille. Let me chime in while everyone is doing that. And I can certainly speak from the local level and Devin chime in. Local, so by violations, you mean statewide or local jurisdictional?
Any?
Any, okay. So we have to kind of modify the any. On the local, most local jurisdictions hold on to their own violation data. If MDE has to come out and do an inspection, they have the violation data. So that's why I said hold on to that for a second, because that's a little more complicated. And Devin, you can certainly chime in if you want to.
If Kaylee is on, I'd like Kaylee to at least address what data we have, and then I can try to make sure that it gets into our screening tool if it's not there already. But I am not sure. I believe that the strategy was that any data points that MDE collected that were relevant would end up in our screening tool. I am not sure. I'd have to actually go on and check.
So I guess maybe what we could view that sticky note as is ensure that violation data is in these databases instead of having a question.
I will chime in again is that, and Devin will say that that is a lot easier said than done, which is one of my stickies is data sharing agreements, because it's not that easy on the local level then to the state level to do it. Oh,
Secretary,
yeah, I was just going to chime in a little bit. And that's a very good question, and we are support transparency, and we've been working for the last year into having databases, inspection reports, and everything live. And the water science administration already has reports that when we do inspections that and they're tracked down and reported. But the EJ screening tool, if it begins adding violations, because I can go to a house today and be out of compliance, and go to the house a week from now and be in compliance again, and then back out of compliance. So it's not. It was meant to provide a screening tool to help us determine what areas are the areas that are underserved and that we need to focus attention to do inspections, to do better permitting, to do investment in infrastructure, and that's where it will help us to, as a tool to, but not necessarily pile up all the inspections that we do, because that's a different mandate that we have, and we're working on that, and it's already available in. It's called Open MDE, where anyone can see our inspections almost not live up to the minute, but fairly quickly, and with no edits on it. So, but how do we integrate those two? How do you? It'd be good to explore that. I just don't know. Like Emil says, this is said and done, and but I would put that sticky like on something to. Can it be done? That would be my question. How can it be done? And how can we do it without overpopulating the screening tool that becomes so too much information, then it becomes useless. That'd be my 2 cents without even talking to anybody.
So Secretary DeBlata, I saw that while you were talking, Delegate Boyce and Adams Conley both raised their hands. So not to play favorites, but I think Adam, your hand was raised first.
I mean, correct me if I'm wrong, HT, but you're specifically talking to lead, and that sticky note talks about things like mold and pests, which are a whole different animal in terms of city or county or state involvement, and there's so much more nuance to mold and pests that I don't know that anybody really tracks that unless there's a really egregious violation of some sort.
Delegate Boyce? Thank you. There you go.
Yep,
Okay,
I'm
good.
here. So yeah, I mean, I said that to say, I think to the earlier point about, is it specific violation that we're looking for? Because if we pull up violations and one particular area, maybe in my district, for instance, may have a whole bunch of violations, and when I drill down, it's like, 100 seniors who didn't get their grass cut on time, or, I mean, it could give broader information about maybe a need, but I'm wondering, are we looking for certain specifics? And then, for instance, if you do have a license for a rental property, there are certain things that have to come with that rental property before you even can get that license. And so if they're in violation, then more than likely, then they don't probably have the proper licensing to begin with. So just wanted to clarify what exactly are we specifically looking for, if anything, and do we want to track that? But I think to Mr. Horatio's point, how much information is too much information, and what do we specifically need? So I'd certainly be open to it, but I'd be open to specific violations that as it related to health and housing, health, and property environmental issues.
So the three that I listed in the sticky note were mold,
Yeah, I saw that.
pests, and lead. Yeah,
Right.
those were the three that I was thinking of.
Yeah.
So
Yeah, but those- yeah.
let me just say that we're at 11, and what I'd like to do now is I don't want to curtail this interesting discussion. I do want to recognize that I suspect that there's a huge amount of discussion to have on any of these, and so in the interest of finishing up and actually coming to resolution, I'd like to move us back for a moment now to the screen on specific initiatives, and which is screen 3 out of 5, I believe, and conduct the same exercise, which is to put a bunch of dots up. We'll put the dots up and then take a couple of minutes to do that. And then I'd like to, so go ahead and again, consider yourself to have 5 dots worth of voting. Go ahead and spend some time voting. That's a very big dot. But go ahead and we'll make copies of those. Go ahead and spend some time voting on the initiatives or policy issues. And then we'll take about 5 minutes just to sort of look at these and think about them. Again, I don't want to necessarily get to an answer here, but I would like to look at these 2 screens and the voting results and sort of think a little bit about what the implications are, and then we'll have an opportunity for public comment.
Cliff, just to clarify, we're voting on or putting dots on what we've prioritized or think are the most important.
Correct. That is correct, Kristen. And again, it's the honor system because we have no way of knowing who's moving which dots.
Is it just me, or do some of these dots look like they're overlapping or not?
Yeah, Paula, I'm making a big stack of dots, and so they're all on top of each other. So the ones that kind of right in the middle, that's just a big stack of dots. I'm just
then
seeing the one. So.
I'm sorry. I'm looking down at like I'm on the 4th one, and it looks like there's some dots that are stuck in between ideas. I just wanted to point that out, but that might just be my Jamboard. I don't know.
Yeah, no, Paula, there's a certain amount of imprecision in this because what we've tried to do is replicate the imprecision of life in the Jamboard. Or maybe not. All right, and let's take about 2 more minutes. And then what we'll do is we'll just open this up for discussion a little bit. And what I'd like to do, at the risk of, I don't think we're going to have a report out per se because we didn't have breakout groups. But I would like to, if people have finished voting, what I'd like for us to do is start with actually the policy initiatives, and for people just a little bit to have some discussion about what strikes them about the kinds of priorities that are represented here, not by the size of the circle, but by the number of votes and the kinds of themes that have emerged. And then we'll do the same thing with the needs piece. And so let's just take about 10 minutes, if people have finished voting, to talk a little bit about what, as a result of this discussion, feels like it's a theme that either has some commonality across the groups or seems just sort of overwhelmingly important, as we sort of think about this as a collective group for maybe the first and last time, and it'll sort of depend on how this goes. So, comments?
I know we're still sorting this, but I know there were more comments on getting community engagement and to be coupled into that, but I know that'll take time. But I think there's a real move to want to have kind of translation, definition, and measurement sorted out here. And I think that has got to be a priority of how we're looking at things. Nsé has her hand up.
Yeah, Nsé?
Yep, thanks. I'm along those same lines. I'm seeing a lot of synergy between what is available to us now. For example, the new infrastructure law, state, appropriate or state decision making on how and when those funds are distributed. So a lot of, I think, synergy around prioritizing highest risk populations, obviously indicators to identify what those high risk populations are, such as, for example, replacement of lead service lines, which is clearly discussed in the mandate.
Thanks, Nsé.
Cliff, the other thing that on the building on Nsé's comments is we have an election, a gubernatorial change coming up in the state, whether it stays in the same party or moves parties, who knows. And I think there ought to be maybe something that we do that everybody could voluntarily attend if they want, on a briefing on the infrastructure law, and the other for the commission members, which we would be happy to help advance here. And those things that likely will be decided on in the next 6 months, and those that will be punted to the next administration will be important to understand.
Thank you, Ruth Ann. Other comments?
And punted, I don't mean by that negatively. I just mean those things that will play out in the future.
Yeah, understood. Other comments or considerations? Oh, good. All right. Thank you, Eamon. I wanted to make sure that somebody got Vancia's comments. Delegate Boyce?
Thank you. I'm doing 2 things at one time, so I'm off camera doing another. I'm sorry. So I want to say something a little sensitive, but like I see comments like, erase racism. You can erase racism and you'll still have classism. You erase class. I mean, there's always going to be something, which I don't like saying, but I think it's important to for us to think a little broader beyond that, because you're always going to have something. I think the more policies we set in place to create equity for everyone, I think those things will root itself out. But merely just saying it, I think is thank you. But I just respectfully, we have to go bigger than that, because it exists every day. We've seen it existed in the last week with these mass shootings. So I just want us to be a little careful and sensitive and a little bit more forward thinking as we talk about that, not just racism or classism, but the policies that we put in place that will then push out and root out those issues. So
thank you, Delegate Boyce. Other comments or questions? So we've come to what might be the most difficult part of this, which is summing up. What I want to do, I think, is ask the chairs if they'd like to take a crack at summing up where they think we are now based on all of the thought that has gone into the past hour and a half, or hour and 10 minutes, or whatever it is. Yeah. And I guess Ruth Ann, Camille, does one of you want to start first?
Camille, go and I'll follow you.
Okay. One, I would be remiss if I didn't say thank you to everyone in all of this hard work. In my short time serving as the chair of this commission, this is the first time all three commissions have gotten together. So this is huge. And the work that you all have done is huge. And two, it's always great to see the intersection of everything that we do, and sometimes take for granted all of the work that everyone does in their own little space and bubble. And I saw some overarching themes. I mean, data is a huge part of all of what we do. That kept coming through. Health, like health equity means something different to all of us, but literally equality and justice for all is something that we all just have in common, depending on whatever it is that we address. But that was clear for me as well. Cliff, you will probably talk about next steps in your space. If not, I'm looking forward to seeing this synthesized and figuring it out how we put it into the work that we do. I will come back to what Suba said, and we will send you all in the bills that we've gotten very clear definitions on vulnerable, overburdened, underserved, of how the legislature has kind of taken some of that lead and defined that to make sure we're at least all using the same nomenclature. What I will ask Cliff and Ruth Ann if we can do is just in general, do a better job of not promoting, but bringing awareness to what the three commissions do. And it's something that we all struggle with. And also, and I always use this time, and I'm going to stop, is as a pitch for other folk to encourage others to join the commissions. We're interested in this work, and I am lucky enough to have neighbors and parents kind of serve on CJAC, but we definitely need more. And can walk people through the process. Devin and Lisa, Eamon can do it as well, but we definitely need more interested people doing this work. So that's all I got. Ruth Ann?
Well, first of all, I just want to thank Delegate Boyce for her comments about getting down to the fundamental kind of policies and practices that we need to look at. I do think getting strong data and translation, as I said, will be mighty important here. And this idea of understanding where the dollars are, what and how they are being spent, and what we may need to make recommendations on. And I will say we got to keep our eyes on the gaps that even with all of this, there's going to always be a gap that would need to be driving those gaps and trying to close them. But I think the idea of fundamental environmental justice and equity is throughout these commissions, and also practical, doable solutions to get this driven to the communities of greatest need. And then the last is, how do we build further and further engagement in community of the work of the commissions, access to input and representation in all of the seats on the commission. And I know that's a goal that my agreement to take the lead commission was to help think about that, drive that, and have good batons for that. So I do also want to just take a moment to thank the agency staff who spend so much time supporting these efforts, going to be translating these efforts and executing them, and our drive to have transparent data to the public, which is going to still take a lot of work, and ensuring that we have more uniform application of this work across the state. We need it in Baltimore City always, but we need it in places across the state that don't get touched as much by the benefit of the work. So I just, I'll sign up on my comments on that and really appreciate the amazing input and the sorting that we need to do in terms of prioritizing or the good ideas for the work ahead.
Thanks, both of you. And so I have a number of thanks, but before I do that, let me just, for people who would like to make public comments, if you would please put your names in the chat now, and we'll take public comments in the public comment period when you submit it. So please put your name in the chat, and we will have an opportunity for public comments. I just have a couple of things. First, I really want to thank all of my co-chairs for all the planning that went into this, and again, the colleagues who serve on staff, particularly Wendy Phillips, Lisa Nisley, and Eamon Flynn, who did an heroic job of keeping up with the Post-it notes, moving them around and reshuffling them. So much appreciation to them for all of that work. And to all of the CPAC members and other commission members, this has been incredibly helpful as in terms of sort of thinking about it. I would like to suggest a couple of concrete next steps. One is, I think that we will, as staff and chairs, collect all of this and attempt to put it into some kind of document to record it. It may or may not have an official life amongst any of the three groups, but we'll try to collect it in one place for all three groups to come back to if they choose to do so. And I think the chairs have agreed that that would be the most efficient way of deciding how to make use of this session. The second thing is that I think that I agree with the comments both of Chair Burke and Chair Norton with respect to the importance of data and our ability to present data. As well, I also want to say that it's been really just a pleasure and an honor to work with all of you on this important topic, and we're looking forward to continuing the conversation. Whether we decide to get together as another group, as a similar group at some point in the future, I think will be up to the individual commissions and councils to decide whether they feel that was useful. And I think as chairs, we would look to the direction of our respective groups for that. Okay. So that being said, now an opportunity, and let me just recognize people in the order in which they put their names in the chat. So Patrick Diarmi.
Hi, my name is Patrick Diarmi. Can you hear me?
Yes.
Great, thanks. So I'm a staff attorney at the Chesapeake Legal Alliance. So my comment is for the Environmental Justice Commission, but I just want to say thanks to all the commissions and all the work that y'all are doing. But my question / comment for the Environmental Justice Commission is, I heard recently about some like local air quality monitoring for sort of non-stationary sources that MDE might be doing around the state, particularly in Lothian and in Anne Arundel County. I didn't know if the commission knew anything about that. And if they did, if they could pass along any information to me, that would be great. And that's my comment. Thank you.
Patrick, it's Camille, and I think Devin is on. If you could shoot us an email.
Okay.
I will put my email in the chat with that specific question because we want to make sure we answer you with the best possible data and answer.
I will. Thank you.
You're welcome.
Okay. Thank you very much, Mr. Diarmi. Veronica Corella.
Hi, I put 3 quick comments in the comment area, but I'd like to read them. My first comment is CPAC has a statutory duty to ensure that the Maryland General Assembly's Joint Chairman's Report requirement that MDA, CPAC, and MSDE produce an IPM in schools report by December 1st, 2022 is satisfied. Please promptly schedule a CPAC meeting per section 13-15-06 that says CPAC has a duty to review and comment on existing rules, regulations, and standards to ensure that they protect the health of children from environmental hazard. This is a statutory duty and cannot wait until the next scheduled CPAC meeting on September 12th to be announced and acted on by CPAC. Please reinstate the original June 13th CPAC meeting or promptly schedule a CPAC meeting to discuss this new requirement and the time-sensitive outstanding CPAC action items. That can't wait till September 12th. My second comment is, per the discussion at our April 20th CPAC meeting, and as the school's work group chair requested prior to this meeting today, to facilitate CPAC's contribution to this report, and to satisfy our statutory duty to gather and disseminate information to the public per section 13-15-06-4, please make the Indoor Air Quality in Schools Work Group Status Report presented at a public meeting on April 20th, 22, that PDF available to the public by posting it on the CPAC website. This status report is a product of the work group presented at a public meeting in response to a request made at the January 26th CPAC meeting by the chair that the work group review the information provided to CPAC by MDA and report back to CPAC at the April 22 meeting. This is public information and is needed to meet the Maryland General Assembly's requirement. These requests are consistent with CPAC's statutory duties and responsibility to the children of Maryland. And my third point, which I don't have written here, is there is no representation on this call from either the Senate, the House, or a parent rep with regard to representing the parents on CPAC. So I would say that outstanding issue, as the former chair, as a former commissioner representing parents, I feel like I have an obligation to stress that parents need a voice through their parent rep and through our legislative representatives that are required by statute to be part of this commission. Thank you.
If I'm not mistaken, Delegate Boyce was very vocal, if I'm not mistaken, but the parent rep is certainly something, and Cliff, you can chime in I feel comfortable. It's certainly something we always need to work on, but the timing of the meetings is just a host of reasons why having a parent rep is always an issue. But I agree, it's something we need to work on and do better ultimately.
Thank you.
Thank you very much. And thanks, Ms. Corella, for your comments. All right. Are there any other members of the public who would like to comment? All right. Any other counselors, commissioners, any other comments?
Hey, Cliff, it's Camille. I actually will have an offline conversation with Megan just about violations, where they're listed, how they're listed, and I may end up having to involve housing, but it's such a layered conversation that I want to dig a little deeper with Megan to figure out what she's looking for. So I just want to let you know, and we'll get back to you when we figure out how to get her or how to get to where she was going.
Got it.
It's such an important conversation, Camille. Public access, right, to what is happening will help us to have public engagement and faith, but will help us identify barriers. So really quite important. And Cliff, if I may, to the comments that the last person made to the one commission, I think it goes for all of us. And I know in the lead commission, we've been struggling for that representation and engagement. And it is a commitment of mine for the lead commission to have better parent community and legislative active engagement. So we hear those comments for all of us, share those, and we're committed to it. And in fact, I will welcome anybody on this call to work with me and our commission to improve that. So
thank you very much, Chair Norton. Laura Stewart, you wanted to make a comment?
Hello, Laura.
Hello. Sorry, I'm a little dark over here. We've rebooted our state PTA organization. It's now called Free State PTA. And we would love to help with the parent engagement on any commissions. So if we could start that conversation, we would love to help fill those positions. I think there's a lot of interest out in the community, especially since we've had this health scare. It's brought to light a lot of other environmental issues. So please reach out to us, because we want to help and we want to be that link to parents, not just PTA, really, just to schools, period, because we have enough people out there that we can see what's happening on the ground. So thank you so much.
No, thank you so much, Ms. Stewart. Much appreciated. No, that's great. And we will take you up on that offer. Let me also recognize Dr. Diana Abney, who is health officer for Charles County and the MACHO representative on the Children's Environmental Health and Protection Advisory Council, because I don't think Dr. Abney was here at the outset and got introduced. If there's anybody else who's a counselor or commissioner that we didn't introduce, please let us know. Secretary Tablata, did you want to offer any closing comments?
No, my only closing comment would be I definitely would look forward to reviewing the catalogs of the different sticky notes that were put in. I think there's a lot of probably whatever great idea. I'm not a good operator of that system, and I was trying to read the little notes and I said, finally I said, well, I just wait for the Reader's Digest version. So I'm looking forward to reviewing things, and I think if we can put them into short-term, mid-term, long-term process, we can work toward a common goal. I think that'd be what I would look forward to see what can we do.
Thanks very
everyone.
much.
I'm sorry I had to drop off temporarily for another important call, but I'm joining you back.
It's always, we're always happy to see you and have you here. Dr. Abney?
Hi, Cliff. You know better to introduce me because I'm always going to say something. One, I'm sorry I was late. I had an unexpected meeting that came up and then ran a little long. And Ms. Stewart, thank you so much for offering up the PTA or PTSA is something that is dear to my heart. And thank you also for saying that there are people you will get in touch with other than PTA members, because I was frantically typing that many parents are not part of PTA. That is sometimes an equity issue because of having to work second jobs, et cetera, et cetera. So thank you so much for saying that you will facilitate opening it up to more parents. And I think Regina said, considering changing the time of this meeting might help with parent participation. And that is very true. I've been on many boards, some of which are from Children's National. And one of the things we've done to try to increase our parent participation is to either look to people who are already part of an organization, as in either a parent navigator or a parent who happens to be employed by one of the organizations we work with, or by moving the time of the meeting. And for some of us, frankly, that would be better too, because things like those meetings that come up in the middle of our workday wouldn't happen. And since this is not an every week meeting, most of us could probably handle a meeting that's a little later in the day. Thanks, Cliff.
Thank you, Dr. Abney.
You're welcome,
All right.
Dr. Mitchell.
All right. It's 11:28. I think I just want to recognize the fact that we've got 3 groups here and we've still managed to finish on time. This is not a mean feat by any means. Not at all. I just want to say thank you so much to everyone involved. Thanks to the staff. Thanks to my co-chairs. Thanks to all of you for all of your willingness to offer up thoughts, etc. And we'll look forward to following up with you with the summary of the meeting as soon as we take a deep breath and then arrange all the sticky notes. So best wishes. Thank you all. Have a good day. Be careful of the rain.